I request Dr. Roy Francis, the Scientific Committee Coordinator, to introduce the chief guest, Dr. S.K. Ojha, Dental Council of India.
Good evening, respected dignitaries, my colleagues, ladies and gentlemen. We are in for a real treat tonight. Our guest speaker is a man who has been the driving force behind Dental Council of India from 2009. He is the person who knows the whole history, the stories, the challenges, and the little-known secrets in the corridors of DCI. He studied at A.R. Ambedkar Dental College, Calcutta, India, the oldest dental college of Asia, graduating in the year 1982. He was awarded Masters in Periodontology in 1990 from Mumbai University. Dear friends, beyond your toes, our chief guest is an army man. He was commissioned in Indian Army Dental Corps in 1983 and loyally served the force for the next 28 years. During this period, he excelled in various fields, including academics, research, and peace missions. He has done many interesting works, especially on guided tissue regeneration. He commanded 2 dental establishments and held the post of HOD of Periodontics at Armed Force Medical College, Pune. In 2008, he was awarded with the Vice Chief's Commendation. Those who don't know what is commendation, the commendation card shall be awarded for individual act of gallantry or distinguished service or devotion to duty performed in operational or non-operational areas. In December 2009, he is appointed as the Secretary of DCI by Government of India. He is a very entertaining speaker, and last year, he has requested the Ministry of Health India to convey its approval to add tobacco in the syllabus of Community of Dentistry in the curriculum. Ladies and gentlemen, please join me in giving a warm welcome to Dr. Colonel S.K. Ojha.
Good evening. His Excellency Shri Satish Mehtaji, Ambassador of India to Kuwait, Assistant Under Secretary Dental Affairs Yusuf Al-Duwariji, then Professor Jawad Bihani, Dean of Dental Academics, KDA President Dr. Ahmad Abdul Rahman Asad, KMA President Muhammad Al-Mutihari, Dr. John Joy President AIDK, Dr. Phillips Secretary, members of IADK, faculty members, Dr. Shalini Editor, Dr. Anup Kanase, our orthodontic friend from India. I bring greetings from India. This is the skyline which I captured from my Hotel Hyatt residency, and I was very happy to see the flags and all, and when I inquired, I found that the National Day and Liberation Day is around. So I extend my best wishes from India as well as the Dental Council of India to all the Kuwaitis on this occasion of National Day and Liberation Day. I shall be speaking on current status of dental education in India. This is the Dental Council of India building, which is close to Connaught Place, New Delhi. And it used to house Medical Council of India, Pharmacy Council of India, and Nursing Council of India. Pharmacy Council of India has moved near Dwarka, next to airport. The Dental Council of India was established as a result of Dentist Act of 1948, which was laid in the Parliament, and it intended to regulate the dental practice and promote scientific advances. It is still the premier governing body of dental education in India. Its responsibility includes regulation of dental education, profession, ethics, liaising with the Government of India, Ministry of Health and Family Welfare to obtain administrative approval for dental colleges and higher educational courses. There are DCI members who are elected and nominated as per the Dentist Act 1948. They are nominated under Section 3A. They are from the state dental councils nominated. They are the state nominees. Then there are central government nominees. There are 6 number, 4 from Part A and 2 from Part B. Part B are those dental surgeons who have their livelihood before the partition as a dental surgeon. So they also form a Part B group, and now their numbers are decreasing. Then there are some university nominees. Director General Health Services is an ex officio member, and the Medical Council of India also nominates one member. And at present, we have total 67 members. This general body meets every quarter to decide all the agendas which are taken day to day activity. This is a layout, this is the photograph of the general body meeting which was held last year near our Dental Council of India building. Out of this general body, we select an executive committee which decides the day-to-day functioning and governing of the different agendas of different colleges, education and other allied matters. President and vice presidents are the ex officio member, and we have 5 elected members. So these 7 constitute the EC Executive Committee, whose tenure is 5 years based on their nomination or election. And the EC meeting is held every 7 to 15 days. When there are more inspections, then the EC meeting is done every week. Like we have to forward all the inspection reports to the government because it is a time schedule. Supreme Court has given a ruling that before 28 February, all the cases of renewal of masters have to be sent to it. Otherwise, they will be penalized. So to summarize, the DCI is the recommending body to the central government responsible for regulating the establishment of dental college, profession and the dentistry under the Dentist Act 1948. This act was a little bit modified in 1993. The DCI recommendation may or may not be agreed upon the Government of India because the Government of India is the final authority. Further recommendation of the Government of India may be challenged in the court of law. These are the regulations. These are the BDS regulation 2007 revised regulation in which all the curriculum and all classes about the infrastructure, everything has been structured. And these are the MDS regulation 2007 is also there. Based on these regulations, only the dental college can be established or the advanced courses for the MDS degree can be started. How a dental college starts? We have now at present 297 dental colleges. So it seems there is a lot of mushrooming of the dental college, but it is not in our hands. Firstly, the different state of India gives the essentiality certificate for establishing the college. Any person who wants to establish or anybody who wants to establish a college, he has to obtain, the governing body has to obtain an essentiality certificate by the state, and that varies on the dentist population ratio. If the dentist population ratio is not favorable, then they may give the essentiality certificate. Then the second step is university affiliation. Then the scheme is submitted to the Government of India within the time frame. Like for the BDS and all, it is 30th June, and for the MDS, it is 30th of December. Then the Government of India forwards the scheme after duly checking the schemes, they forward to Dental Council of India. Our office staff checks the regulation, whether the infrastructure, the staff pattern, the land, documents and everything is okay or not. We take a legal opinion on that, and after this is checked, the inspections are carried out by the Dental Council of India. During the inspection, the first inspection is the informed inspection because the college has to be established, so we always inform the college, yes, that the inspection is on particular date, so they are ready. Once the report comes, it is seen by the executive committee, and then we decide whether some compliance has to be given or not. If there are some shortcomings, we don't inform the college now, and we give the compliance. So the college is at a you can say loss, because the second inspection, which is a compliance inspection or compliance verification, the college doesn't know. And that time the surprise inspection is done, so the college may be taken aback. Then that report comes to EC, the EC finally sees the report and forwards to GB, and then it goes to Government of India. And the Government of India finally issues the letter of permission. Once the college has been accepted for its starting, then the college has to give surety bond in the form of 2 crore or 3 crore, because that money is required in case the college is closed. That with that money the state government can shift the students to other colleges. The renewal inspection is carried out every year, and that renewal inspection is also a surprise inspection. Once that is the second year renewal, third year, fourth year renewal, since the BDS course is of 4 years, after the fourth year, the recognition inspection is done, and then the college is recognized. In India, the inspections are carried out by the 2 council inspectors for establishment of new dental colleges, as well as subsequently yearly inspections are also carried out, yearly renewal permission, as I have mentioned. Recommendation in this regard are forwarded to GOI, Ministry of Health, for notification. Dental Council of India, after initial accreditation of the dental institution, have a provision to conduct periodic inspection, whether they are maintaining the infrastructure, they have enough clinical material or not. That also is being seen from time to time, depending on the complaints and the periodicity. Then we have, of late, we have started the computerized inspections. For greater transparency and strict control, the EC decides a pool of inspectors in various specialties. We have got ortho, perio, prosthetic, oral surgery. These pool of inspectors, along with the name of college, they are randomly assigned by the computer and they are picked up. Then these inspectors are sent the email before 2 to 3 days of the inspection, and once the report comes, then it comes to the EC and finally to the GB, and it goes to the Government of India. Like for the MDS, the last date of recommendation is 28th February of this month, and we had almost carried 1400 inspections for the renewal of MDS degree. So coming to history of dentistry in India, the history dates back as per the ancient civilization. As you know, the Indus Valley civilization, ancient medical literatures also describe Ayurveda, and Sushruta Samhita describes treatment of disease of the oral cavity known as pyorrhea, and emphasize the importance of tongue hygiene. In Western countries, the tongue hygiene was not earlier recognized, but of late they have also thought of this oral hygiene measure. The formalization of dental education system started in 1883. Dr. Rafiuddin Ahmad, who is the father of dentistry in India, established the first official, fully functional, autonomous dental institution in Calcutta in 1920. I am fortunate that I have passed from this oldest and first dental college of the Asia. This institution offered a diploma of licentiate in dental sciences, LDSC, upon successful completion of a 2-year program those days. The president of Dental Council, Dr. Debendu Majumdar, also is from the same college, and he is an endodontist. This is R. Ahmad Dental College, Kolkata, and this is Rafi Ahmad, who used to run an ice cream factory, and whatever the earning used to come from the ice cream factory, he used to donate to the college to run the college. In 1926, the duration of institution's program of study increased to 3 years for the licentiate dental science and to 4 years program for a Bachelor of Dental Surgery degree, BDS, in 1935. The Dental Council of India was founded immediately after the India gained its independence in 1947. This is a Grand Prix formula which was held in Delhi, so I thought just to change the monotony, it should be put. To start the Dental Council of dental education system in India, we have different types of dental schools and under different categories. We have the government dental colleges, first category, then private dental colleges affiliated with a government university. The third category is private dental colleges as part of a private university. Currently, we have 297 dental colleges in India. In the government sector, there are 41, and in the private sector, there are 256. Last year, because of the strict protocol followed by the Dental Council of India, we have closed 6 colleges. These are the rankings By the Outlook magazines, you can see in 2012, 2011 ranking, there's the first ranking is Maulana Azad Institute of Dental Sciences, where Dr. Anup Kanse has come. He is an orthodontist. So based on the selection process, academic excellence, personality development, infrastructure, PG selection, these all colleges are ranked. Maulana Azad ranks the first, Manipal is the second college, Government Dental College Mumbai is on third position, Nayar Dental Hospital Mumbai on the fourth, fifth is the Faculty of Dental Sciences, the Lucknow, SDM Dharwad is on sixth, Government Dental College Bangalore on the seventh, Bapuji Dental College Hospital on the eighth, PG Institute of Dental Rohtak, ninth, Dr. R. Ahmad on 10th, SRM Dental College, and so we have a various list of the colleges. This is on the left is Maulana Azad Dental College. On the right is the Department of Dental Surgery, Armed Forces Medical College, where I was there as a reader associate professor for almost 7 years. This is a department in one of the dental school. In 2013, to summarize, the total available seats in dental colleges are 24,640. Out of these 24,640 intake, there are 2,490 students are enrolled in the government colleges. So you can summarize that 2,500 seats are in the government and 22,150 seats are in the private colleges. These are some private colleges, Manipal dental colleges with the school. You can see the setup and all. The duration of dental school program is 5 years, of which 4 years includes 3 years of medical and dental clinical work are devoted to didactic teaching and laboratory coursework and 1 year to compulsory internship rotation. Of late, we have asked the interns to give a rural service for 3 months so that the rural people will be benefited as well as they will have the clinical material. Moreover, a lot of carcinoma cases are there in India, so that screening also will be possible with the help of these rural services. This has been just streamlined last year only. The dental school graduates in India are awarded a Bachelor of Dental Surgery, BDS. An update to knowledge of clinical practice and technological advancement in various specialties is provided through the lectures, seminar, demonstrations, and laboratory techniques. Familiarity with the modern teaching methods and assessment strategies for undergraduate students are in vogue. Nowadays, last year we have asked all the institutes to have this NAC accreditation. NAC stands for National Assessment and Accreditation Council Certificate Mandatory. NAC is an autonomous body funded by UGC Commission under Human Resource Development Ministry. The preparation and submission of self-study report and assessment is submitted to the executive committee of the NAC, and the NAC team comes and visits the college and they award the certification. It has also been gazette notified. So with this strict control, what I visualize that in future some of the dental schools are going to be closed in India. This is the normal setup. You can see the clinical setup where the students are working. We have another accreditation is NABH. That stands for National Accreditation Board for Hospital and Healthcare Providers. NABH is a constituent board of Quality Council of India, and it caters to the need of consumers and sets the benchmark for the progress of healthcare industry. Infection control, maintenance of data, disposal of waste, patient care, medical safety, evaluation of patient satisfaction for the insurance empanelment is mandatory. And a lot of colleges are getting this NABH accreditation, which is quite tough. This is Bangalore Dental College on the left, and the right is the Bapuji Dental College, Dharwad. With a large increase in the number of dental colleges over the past 10 years, there has been a marked improvement in dentist to population ratio in general terms. There was a similar improvement during the 1980s to 1990s, where the ratio was 1 dentist to 80,000 population. Then it became to 1 dentist to 42,500, and at present the dentist to population ratio in India is 1 is to 13,000. But to be more precise, more number of dentists are there in the urban area and very less are in the rural area. We have further asked the colleges to update their websites. All the existing dental colleges have to maintain and update their websites with the following information: essentiality certificate, university affiliation, land documents, hospital attachment, NAC and NABH accreditation certificates, faculty details with their experience and photographs, list of UG and PG students, university approved holidays and other informations. Departmental postgraduate department in one of the colleges. We had this Grand Prix, you can see the cars are taking off. Now coming to the main topic of this talk, Master of Dental Surgery course duration is of 3 years. These are the other colleges, SDM Dharwad and AB Shetty and Bangalore. The total number of colleges who are providing the MDS master's degree are 196. The government colleges are 34 and the private colleges are 162. Total number of MDS seats in various branches are in government sector 557 and in private sector 4035. So total number of MDS seats are 4592. If we compare this data with the MBBS graduates and postgraduates, we find that in India 30,000 are the MBBS graduates and 15,000 are the MD or master degree graduates. So almost 50% of the MBBS graduates have a chance to do their post-graduation. But in our case, only this ratio is 18% will only get the chance. Admission to all the postgraduate courses in medical colleges across India from is now through a common entrance test conducted by National Board of Examination. A single entrance examination is known as the National Eligibility Cum Entrance Test NEET MDS 2013. So we want to have the good candidate with good numbers. So the master list is prepared from where the state can also have their own merit. The students pursuing the MDS degree are trained to write the research papers, which is just like a passport, and a thesis on the research project under the preceptorship of the guide is mandatory for the course completion. The research topic can be experimental, clinical and epidemiological. When I was in Armed Forces Medical College, I did research and a thesis on the abrasivity of a toothbrush on enamel by SEM study. So this was a very tough task. I had to go put the tooth extracted. I extracted the tooth of orthodontic teeth, put them under the scanner of SEM, did the brushing strokes and then again re-examining it. So I know that how does it work? You have to review the literatures and it was a very tough task those days. The work can be interdisciplinary in nature, including multiple department of institutions or outside institutions, and in consultation with the Department of Biostatics to select sample size and statistical tests applicable. In the first year, all these MDS postgraduate students are taught this biostatics and research methodology so that they become expert in calculating the data and all. The research work will have to be completed and submitted 6 months before appearing in the final exam. Moreover, they have to present their research work in a form of a presentation to the examiners. The research and thesis works are par with the curriculum of PhD which is done in other countries. Rather, it is more strict. Apart from the research thesis, the PG students have to complete a library dissertation on allotted topic in the first year. In the first year only, they are assigned the library topic so that they are used to seeing the book, how to refer the references, textbooks references. They take the guidance of their seniors and teachers, so they become keen to all this study procedure. A good number of lectures, demonstrations are imparted in order to cover the entire field of dentistry and in respective subspecialties. Journal clubs are conducted once a week to make the postgraduates proficient in research methodology. there is structuring, execution, analysis, along with the ability to critically analyze the research work done earlier. The students are exposed further to multitude of cases with various level of difficulty in the clinics. The training is provided not only in the respective specialties, but also interdisciplinary approaches are also applied. The basic sciences students are also undergoing the examination like applied anatomy, physiology, biochemistry, pharmacology. Also there is a subject in the first year. Because our human body is not related to only teeth. The teeth are related to the whole human body, so that compartmentalization should not be there. Because nowadays the patient comes, whether it is a geriatric patient or with a diabetic or a heart problem, so one has to know what precaution you have to take. Concurrent clinical training is also provided in other related specialties for overall clinical training for this purpose. In pediatric surgery, plastic surgery, otolaryngology and radiodiagnosis, especially for the postgraduates who are seeking this oral and maxillofacial surgery courses. It is mandatory for a postgraduate student to present at least 2 scientific papers, posters in a recognized conference before they appear for the final exam. The second criteria is the postgraduate students have to publish research and clinical papers in any of the indexed journals as a part of the fulfillment of their curriculum. Training in methodology of teaching. The postgraduates will attend the undergraduate classes to learn the methodology of teaching, and they will be encouraged to teach the undergraduate students. In this form, we see how the micro teaching, OSCE, OSPI, or whatever the latest teaching technology, so that is refined. The preparing the lectures and getting it corrected by a faculty members under whom he works. Seminar and journal clubs. There is a strict guideline that whenever the inspectors go, they check whether the seminar and journal clubs are done or not. They see the documents, they see their tabloids, whether it is prepared or not. Each PG student has to present a minimum of 5 seminars per year. Apart from the seminar, 5 journal clubs has to be also conducted each year by every PG students. These are the various course curriculum I will just run through. In prosthodontics, you have tooth-to-tooth surface restoration, ceramic, onlays, crowns, 3/4 crowns, pinlays, pinholes, telescopic crowns. Then in fixed partial denture, cast porcelains, cast metal, porcelain fused to metal, multiple abutment, adhesive bridges. Then interim provisional restoration, fixed partial dentures, implant supported prosthesis, removal partial denture, RPDs are there. Implants are also included in the MDS curriculum in India as early as 1994. This all the systems, Brainmark, Ostem, and then this other BioHorizon, these all systems are being used. And we have got our indigenous implants also, which has been developed in the armed forces. They are also being used. These are some cases which I thought just I will show. These are complete dentures, the neurocentric occlusion, characterized prosthesis, anatomical, all these are also the part of the. Then geriatric care is also there, implant supported complete prosthesis. Apart from this, they are doing the maxillofacial processes. When I was in FMC and other, this is all roadside accidents in which you have to place the cranial plates and all are made in the acrylic, because acrylic is very cheap. So our oral surgery trainees used to liaise with the neurosurgery department and used to prepare these cranial plates, and whenever the axis osteotomy has to be done, some tumor is there, postpharyngeal and all, they used to split the mandible so that the neurosurgeons can have an access to the postpharyngeal tumors and all. So these all processes like eye, ear, nose, other processes are also being trained time to time. Then TMJ syndrome management's full mouth rehabilitation, interdisciplinary treatment modalities, management of failed restoration is another topic. Being a periodontist, I will just skip through all these procedures are there. This is the guided tissue regeneration, in which you can see there is a bone loss on the canine, and that has been placed with the regenerative membrane, that is a BIOS and BioGuide. You can see how well it is completely healed. Then periosplains, regenerative techniques, Oral and maxillofacial surgery, all these injections, IV, minor suturing, incision, drainage, impaction, pre-prosthetic surgeries, then cyst enucleation, fractures, biopsy procedures, removal of salivary gland. They are posted in various departments like in plastic surgery, eye department, ENT, so they have the interdisciplinary approach. Sometimes the orbital fracture, how to reconstruct the orbital floor, blow in fractures, zygomatic fracture. So they have to have complete exposure to all these clinical procedure. Every institution will have a well-equipped minor and major operation theatre. This is just a view of that. In order to impart highest and strict training to the oral and maxillofacial surgeons, the DCI has last year gazette notified this medical college attachment procedure. Attachment to a medical college within 10 km of distance has become mandatory for applying the scheme for oral and maxillofacial surgery MDS. The government notification has already been done. So if you want to have oral surgery, if some college wants to have oral surgery, the college must have an attachment within a 10 km. So lot of colleges are having this embargo and they cannot open this oral surgery. This conservative dentistry and endodontics, these are the various syllabuses are there. RCT anterior, endo surgeries, cast gold inlays, and I think a lot of endodontists are there in the country, so I did not elaborate on this aspect. So I think their numbers are more. And oral pathology, oral microbiology, this for the diagnosis of all these lessons and all, we have a good setup of examiners and all. Oral pathology, then clinical pathology. Now we want to have another course, that is a forensic odontology, that also we are going to introduce most probably within a year. Then public health dentistry, that clinical assessment of patient learning different criteria, school-based preventive programs. I have seen a good program in Kuwait. I was very happy to see then pit and fissure sealant, minimal invasive treatment, then assessing of oral health status of various target groups, application, topical fluoride application, I think is being carried out in Kuwait school health program, planning total health care for the school children in adopted school. So we have got the camps, buses are there, they go every year, every month the camps are held in the suburban. And for this purpose, we have asked the colleges to adopt few satellite centers. So wherever the college, in a 50 kilometer radius, they can adopt 2 satellite centers. And they are now supposed to provide the free treatment, basic treatment to all the clientele of that area. And those clientele we will have as a clinical material of the college. So in that rotation, so a lot of rural population is also going to be benefited. The pedo and preventive dentistry, I did not completely go through it. Oral medicine radiology is another field. Then laboratory investigations and all oral manifestation of the disease, TMJ dysfunction, forensic. Now coming to the conferences, in India, Indian Dental Association, which is another body, conducts annual national conference every year in all the states, and at the state level also the conferences are there. So the students can easily attend the conference and have the CDE points. All the specialty subjects also, like this oral surgery, oral maxillofacial surgery, perio, pedo, they have their national publication as well as their national conferences. When I was a student, there used to be only one national conference of the specialty. But of late, there is a PG convention also where the students can interact in the midterm. So now each specialty has got 2 or 3 conferences. One especially for the postgraduates in which they can present the paper and they can interact, and one is a national conference. Indian Society of Dental Research and Piri Fortune Academy conducts their own annual conference. Then FDI also conducts their conferences. Credit points will be given by DCI to all these participants. A minimum number of points, in our case it is 100 points in a span of 5 years in different criteria like aseptic, asepsis, or resuscitation, or processes, or whatever is being mastered. Then the speakers, the various speakers at the conferences, international speakers have come. Dr. Charles Babush, Dr. Roth, Dr. Graber, Bennett, Dr. Brainmark, Dr. Maurice Salara, Dr. Goldstein, Dr. Morige, who works on the laser, Dr. Van Dyke, a periodontist, Dr. Slotz is a periodontist, Glickman, Wirehug, Dr. Miller, periodontist, Wangren, and the number is endless. Whatever I could remember, I have just jotted down. Then there are a lot of our Indian doctors who have contributed to the international panel. Dr. Shadasev Shetty, Dr. Jyotindra Kumar, Dr. M.K. Prakash, Ashok Karad, Anmol Kalla is an orthodontist, Dr. Mahesh Verma is Vice President of the Dental Council of India and is the Maulana Azad Dental College, Dr. Vinod Krishnan, he is a peer reviewer of the American Journal of Orthodontics. Dr. Pradeep Raju is again reviewer of Indian Society, International Society of Periodontology. Dr. Majumdar, Dr. Saidul Islam is an oral maxillofacial surgeon. He is my classmate and is the best surgeon in the oral surgery who carries all this reconstructive surgery in Calcutta. Dr. Nikhilesh Vaid. Then some of the Indian authors of the dental textbooks to name, Dr. Nilima Malik has written oral surgery, Pankaj Datta dental material, Gurkirat Singh ortho, O.P. Kharbanda, Shobha Tandon pediatric, John Joy dental material, Dr. Sikri Indo, and there are so many authors are there. So our student consult these books and as well as the reference international books also. In continuing dental education, Indian Dental Council of India stresses on the CDE points, and now we are working with the state governments so that the online credit of CDE points can be easily done, so that their license can be reviewed from time to time. The publication of journals also is a big issue. The first Indian dental journal in dentistry started way back in 1925 by IDA. Present day DCI, IDA, all the specialty organization, universities, institutions are having their own journal publication apart from other recognized dental societies and organizations. To name, these are the indexed Indian journals like Indian Journal of Dental Advancements, Indian Journal of Dental Education, Dental Research, Dental Sciences, Journal of Indian Academy of Dental Specialists, Journal of Indian Dental Association, Indian Journal of Orofacial Genetics, Conservative Dentistry, Orthodontic Society, and Indian. We have given the point system. If some author's publication is in all these 9 specialties, we are awarding 15 points to that individual. In other local journals, we are giving 5 points. So that with the point system, the teachers can be easily, can find their place, that where do they stand. These are the journals of Indian Prosthetic Society, then Radiology, Journal of Maxillofacial Pathology, Journal of Maxillofacial Oral Surgery, Journal of Forensic Dental Sciences, Dental Implants. Apart from this, we always, whenever the inspectors they go, they check the library. Apart from the main library, each department is supposed to have a mini library in which the students can study. So this is the library section. You can see the library, how well laid. Then of late, the Indian Board of Orthodontics was established in 1998 to judge the excellence and standard of orthodontics in clinical practice based on the peer evaluation, and other specialties are also in the process of starting such boards. This is the distraction osteogenesis with the first workshop where Dr. Wangren came from Germany, and the distraction procedure for anomalies of the hypoplasia of the teeth of the jaws were there. It was done in May 99 in FMC, and 2 surgical cases were there in Armed Forces Medical College, in which all the participants across the country had participated. Recently, National Survey on Dental Health has been also taken by DCI. It is a 3 years survey. The phase 1, phase 2, phase 3, 4. Phase 1 has been completed in July 10, phase 2 in November 10, phase 3 in February 11, phase 4 in December 12, and it is done by a very prominent Indicus Analyticus group. The phase 5 is likely to be completed in 2013, from which we will deduce the dental health manpower and prevalence of dental disease in urban and rural India. I was happy to see the school oral health program in Kuwait. This is the one picture I just captured, and I was happy to see that they are in 2 decades in service. I saw the pamphlets, the dental basics and all. I would like to mention that our Indian Dental Association has also got more number of pamphlets, starting from mouth ulcers, halitosis, then wisdom teeth and all, and they are readily available, and it is a good educational material. So I was happy to see the same thing here. Now, since I am from the armed forces and the preventive approach, I must tell that in army, all person, including a soldier, officer, is inspected every year. Annual dental inspection is carried out every year, like a medical inspection where they see your ECG and other things. And in the dental inspection, priority 1, priority 2, priority 3 is given. Priority 1, where you find that immediately the patient has to be seen, like some impacted tooth extraction or some caries which is going to be exposed, pulpal exposure, priority 1. Priority 2, in which some fillings can be restored, say within 1 or 2 months incipient. And priority 3, where you can wait for 6 months, like the scaling and root planing, other things. So appointments are given, and the dental DTC means dental treatment completed. Once the inspection is done, within that calendar year, the dental treatment has to be completed, and this is the soldier's pay book on which it has to be endorsed. This is a pay book in which his leave record, his vaccination, his dental treatment record is everything there. So this is a unique thing which is there. This is the dental center at Glacier. So my sincere thanks to one and all for listening, for giving me opportunity to give me this presentation, and I welcome any of the questions and all. This is the Airport Express Metro, which is a good communication in Delhi. This is Gateway in India Gate. My email is there, secretary@dciindia.org. Please mail me. I'll be very happy to answer your queries. Thank you very much. And
Thank you, Dr. Ojha.